Welcome back to another episode of HealthCap Weekly Wrap.
We've got a packed show for you today with updates ranging from federal oversight and infection control to wellness, diagnostics, and even dogs detecting Parkinson's disease.
Yeah, we'll kick things off with a breaking story on why a new federal watchdog report says the Special Focus Facility program isn't working.
Then we'll check in on how the current government shutdown is impacting survey and certification activity in long-term care.
After that, we'll move into 3 stories focused on infection control, including 2 practical tools from APIC and a summary of core isolation precautions from the CDC.
And to close things out, we're shifting into wellness mode with new findings from the Mather Institute on nutrition and brain health and some incredible research on dogs sniffing out Parkinson's before symptoms even show up.
Let's get into it.
So this first story just dropped, and it's a big one. The Office of Inspector General released a report this week saying the CMS Special Focus Facility program, or SFF, is failing to create long-term change in nursing homes.
Right. And if you work in senior care, you've probably heard of this program. It's designed for nursing homes that have a history of serious quality issues. These communities are supposed to receive enhanced oversight, more frequent surveys, and are expected to improve quickly.
But what this new report is saying is that the improvements don't last. Between 2013 and 2022, nearly 2/3 of the facilities that graduated from the program ended up backsliding. Some were even cited for the same deficiencies that landed them in the program to begin with.
That's a pretty clear sign that something's not working. The OIG specifically called out that in 31 states, over half of the communities that exited the program ended up with serious quality problems again within just 3 years.
And one state agency told the watchdog that facilities are more focused on checking boxes, just doing enough to get off the list, instead of truly improving quality for the long haul.
The report's recommendations are interesting. It suggests that CMS consider a facility's ownership history when selecting SFF candidates. It also pushes for more meaningful enforcement tools beyond just financial penalties.
There's also growing concern that staffing-related issues are being overlooked in the SFF criteria. And that's huge because staffing is often the root cause of poor care outcomes.
It really comes back to building a culture of quality. Getting off the SFF list might satisfy regulators in the short term, but unless teams stay focused on long-term care standards, especially after the spotlight moves on, residents are the ones who feel the impact.
This is a call to action, not just for regulators, but for providers who want to show that quality improvement is more than a performance.
And now, let's talk about the government shutdown. As of this recording, it's still active. And CMS released an updated memo about how this affects state survey and certification activities. This is Memo QSO-26-01-ALL, revised October 21st.
So here's what's important. Not all survey work has stopped. Complaint investigations that involve immediate jeopardy, those are still happening. Same with enforcement actions, revisit surveys, and emergency responses.
Also continuing are certain activities funded independently, like hospice surveys tied to the Consolidated Appropriations Act, and CLIA work that's not impacted by federal appropriations.
But standard Medicare certification and recertification surveys, those are paused. Same goes for initial certifications and most training efforts, whether online or in person.
If you were planning to onboard new staff with CMS-sponsored modules or prepping for an upcoming routine survey, all of that may now be delayed.
That can create a real pinch point, especially if you've timed audits or team evaluations around a typical survey cycle. The memo also urges states to communicate clearly with communities so everyone understands what's paused, what's proceeding, and who to call for support.
So while it may seem like survey pressure is off for now, the real opportunity is in preparation. Use this time to reinforce training, run mock audits, and address gaps before oversight resumes.
It's always better to stay ahead of the curve, even during a shutdown.
Now let's move into infection prevention. First up, the Infection Prevention Surveillance Plan Essentials for Long-Term Care from APIC.
This resource is designed for long-term care settings, and it's incredibly practical. It walks you through how to build a surveillance plan that makes sense for your community, even if you're working with limited resources.
And let's be honest, many teams are. Infection prevention is often just one part of a nurse's responsibilities in senior living. This guide helps streamline the process, choosing which infections to monitor, setting benchmarks, and figuring out what to do with the data you collect.
It includes considerations for both healthcare-associated infections and community-acquired ones, so you're not just reacting to outbreaks, you're building a system for early detection.
It even covers how to conduct data analysis without high-end software. That's a big win for smaller communities or rural providers who don't have tech-driven tracking systems in place.
There's a strong emphasis on communication, too. Sharing infection trends with staff can improve engagement, encourage reporting, and create buy-in. And it positions infection prevention as a shared responsibility, not just something the DON tracks in a binder.
And if your team is just getting started with NHSN or hasn't used it in a while, this resource can serve as a foundation. It's not overly technical. It's really about helping teams get organized and focused.
Next, we're looking at another resource from APIC, this one on implementing the use of enhanced barrier precautions in skilled nursing settings.
And this is a big one because the CDC has expanded the criteria for when these precautions should be used. It's no longer just about residents who've tested positive for multi-drug-resistant organisms.
Exactly. It now includes residents who are at increased risk for carrying those organisms, even if they've never had a positive test. That includes people with tracheostomies, feeding tubes, catheters, or chronic wounds.
The recommendation is to use gowns and gloves during high-contact care activities with these residents. Things like dressing, bathing, transferring, or wound care.
And what I really appreciate about this guidance is how detailed it is. It helps you figure out where to place PPE stations, how to handle signage that doesn't feel stigmatizing, and how to keep workflows efficient.
It also addresses the human side, how to explain these changes to residents and families in a way that feels respectful and transparent.
So instead of saying, we're using precautions because this person might be a risk, you can say, this is part of how we protect everyone in our community, including you.
It's a subtle shift, but it makes a difference in how precautions are received. And ultimately, the goal is to prevent transmission before it happens, not just respond after an outbreak. If your community is updating infection control protocols this season, this is a must-read. Now we're looking at the CDC's summary of recommendations for isolation precautions. While the full guidance goes back to 2007, this summary was refreshed in 2023, and it's still the gold standard.
It breaks infection prevention into two core approaches: standard precautions and transmission-based precautions.
Standard precautions apply to all residents, regardless of diagnosis. That includes hand hygiene, respiratory etiquette, proper PPE, and safe handling of linens and sharps.
Then you've got transmission-based precautions, used in addition to standard ones, based on how an infectious agent spreads. That could be contact, droplet, or airborne.
The summary gives clear examples for each category, and it also notes which practices are backed by strong evidence versus those that are more situational.
Another strong point is how it reinforces leadership responsibility. Infection control doesn't just live with the care staff. It requires administrative backing, policy support, and a culture of consistency.
This is a great reference tool when onboarding new infection preventionists or when updating your facility-wide protocols. Even if nothing has changed, reviewing the fundamentals never hurts.
Shifting now to wellness, we're looking at a study from the Mather Institute called Food for Thought: Older Adults' Views on Healthy Eating.
This report came out in early 2023, but it's still very relevant, especially for communities looking to enhance cognitive wellness through lifestyle programs.
They surveyed over 1,000 adults aged 55 and older, asking about their eating habits, hydration, and beliefs around food and brain health.
What they found was pretty compelling. People who believed there was a connection between diet and cognition were more likely to consume protein, stay hydrated, and avoid ultra-processed foods.
And it wasn't just belief. Those behaviors were tied to better cognitive performance. Specifically, better word recall and fewer memory complaints.
The report suggests an opportunity for education. If residents are told that their food choices impact memory, they're more likely to eat in a way that supports brain health.
That's something dining and wellness teams can tap into. Even something as simple as adding a brain boost label to menu items or hosting a hydration challenge could encourage healthier choices.
It's a good reminder that dining isn't just about nutrition. It's a huge part of resident engagement and well-being.
And finally, we're ending with a bit of science that's as heartwarming as it is groundbreaking. A recent study published in the Journal of Parkinson's Disease found that trained dogs can detect Parkinson's before symptoms appear, just by smelling skin swabs.
I mean, it almost sounds too good to be true, but the science is there. 2 dogs were trained by a nonprofit in the UK, and they were able to detect Parkinson's in samples with up to 98% specificity and 80% sensitivity.
Researchers believe dogs are picking up on changes in sebum, an oily substance the skin produces that becomes altered in people developing Parkinson's, even before they experience tremors or stiffness.
This could open the door to earlier screening tools, especially non-invasive ones. And for residents in senior living communities, early detection could dramatically change care trajectories.
Now, no one's saying we're replacing neurologists with Labradors, but studies like this help validate other forms of early diagnostics and highlight how much more we still have to learn about aging and disease detection.
It's an encouraging way to end today's episode, and a reminder that innovation often comes from the most unexpected places.
That wraps up this week's HealthCap Weekly Wrap.
We started with breaking oversight news, moved through practical infection control tools, and closed with resident wellness and emerging science.
You can find links to all the documents we covered today in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
Until next time, take care and keep making a difference.